Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and on today's episode, I will be diving into a question involving pressure ulcers and how to properly stage them. A 55-year-old male patient presents with a full-thickness skin loss involving the epidermis, dermis, subcutaneous tissue, and bone. He also presents with extensive necrosis. Which of the following below is the appropriate stage of the wound according to the National Pressure Ulcer Advisory Panel? Option A, Stage 1. Option B, Stage 2. Option C, Stage 4. Or Option D, Stage 5. So before we dive into the correct answer choice, let's first review what a pressure ulcer is. A pressure ulcer is also called a bed sore or a decubitus ulcer. They are skin and soft tissue injuries that form as a result of constant or prolonged pressure exerted on the skin. These ulcers occur at bony areas of the body such as the ischium, the greater trochanter, the sacrum, the heels, the malleoli, can be lateral or medial, but it is more often lateral, and the occiput. So now that we have reviewed what a pressure ulcer is, let's dive into the correct answer choice. So the correct answer is option C, a stage 4 ulcer. Since a stage 4 ulcer includes a deep ulcer with exposed tendon, ligament, fascia, cartilage, or bone, which is exactly what is being described in this question. Now, remember, option D included a stage 5 ulcer, which is not a staging. It is only staged 1 through stage 4, so that was a little bit of a tricky one there. So now let's review all of the various stages of pressure ulcers. This is a common topic that does appear on the boards exam, so I highly recommend you understand these different stages and what the differences in presentation will be for each stage. All right, so first up is a stage 1. This is a non-blanchable redness of intact skin at localized spots over a bony prominence. There can be increased skin temperatures, and if pressure is relieved within 24 hours, there may be recovery. Now, a stage 2 is a partial thickness skin loss of the epidermis, dermis, or both. This is a shallow or superficial open ulcer with a red or pink wound bed. It kind of looks like an abrasion or a blister or a little bit of a shallow crater. There will be no slough or bruising during a stage 2. Next up, we have a stage 3. This is a full thickness tissue loss with subcutaneous tissue that may be visible or necrotic. Now, bone, tendon, or muscles will not be exposed with the stage 3. That is the biggest difference between a stage 3 and a stage 4, that there will be no bone, tendon, or muscles exposed. There can be some undermining or tunneling. And if you feel it's deep and don't see subcutaneous tissue, it can still be considered a stage 3. That's something important to note. Now, a stage 4 is a full thickness tissue loss, but now there is that exposed bone, tendon, or muscles. There can be slough or eschar present, just like there can also be undermining or tunneling. Now, a stage 4 is dangerous because osteomyelitis is possible due to the exposed bone. Now, there's also an unstageable ulcer. This is when the tissue depth or damage cannot be determined due to slough or eschar, something else covering the wound bed itself, so we can't properly stage it. So that would be considered an unstageable ulcer. And finally, we have a deep tissue pressure injury, or a DTPI. This is when there is a discolored area of tissue that is not reversible. This can be caused by when there's pressure underneath the skin. This will likely lead to more of a full thickness injury in the future. Now, the skin itself did not break down. That's the biggest differential diagnosis with this deep tissue pressure injury. The skin itself did not break down, but that does not mean there is not more extensive injury or damage occurring underneath the skin itself. So this is still a dangerous ulcer. Now, some additional important notes that I want you to be aware of are to never backstage or modify a stage. What I mean by this is you really never want to backstage an ulcer by changing its stage from a stage 2 to a stage 1. Instead, you would document that a stage 2 pressure ulcer has improved to a stage 1. You will also never say that a stage has modified. So you want to stick with the original staging and just document any changes in presentation. So I hope you found this episode discussing pressure ulcers and the various stages helpful. Here's a quote from Steffi Graf. "You can't measure success if you have never failed." That's right, warriors. Use all of your past failures and past experiences to learn from and help you succeed to reach those goals. Never forget, you are powerful. You are strong. You are a final frontier warrior, and you will pass. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms, such as Facebook, Instagram, Twitter, and TikTok. Till next time, have a great day and a powerful tomorrow.